Okay, so me and Avni have done this together, but we'll keep it quite short and sweet to get through it. So this is about the dry needling and the management of back and leg pain. So dry needling, or otherwise known as Western medical acupuncture, is the use of small needles being inserted into skin and muscle. The idea is it's based on trigger pointing, and it's to encourage a physiological and therapeutic effect. So a little bit on the physiology or the suspected way that dry needling works. Obviously between dry needling and acupuncture there's quite a lot of similarities, but there's also quite a lot of interest in how it actually does work. We know that a lot of patients have good feedback from it, but there's still a lot of theories behind it. So the first chart looks a little bit about how we're developing that nociceptive pain and looking at the muscle damage occurring, that's having some chemical reactions that's leading to pain. And then the theory is that that will then activate some trigger points, which is normally when the patients come in and go, oh, I've got a lovely big knot in my shoulder. And the theory is that creates more central sensitization overall. So that's just a little bit more on the physiological effects that actually occur. So those are the 5 key theories behind it. So stimulating a local twitch response, which is trying to get those muscle fibres moving again. Analgesic effect. The theory is it also will help with blood flow and overall neuromodulation, and obviously the placebo effect, which we know can be quite strong with a lot of patients, particularly with chronic pain. So a little bit more on how it's actually performed. Avni, did you want to say a little bit about this one?
Yeah, fine, yeah. So in practice, when I kind of use dry needling, it kind of comes in different sizes. They're thin needles that we insert into the skin, and if you're kind of using it for more acute management, you tend to keep it in there and what do you call it, like create a twitch response within a short period of time. And if it's a chronic condition, we tend to leave the needles in there, but it's usually kind of based on the therapist's preference in what works best for them. Of course, we have to follow the contraindications and make sure that we're only using this modality for when it's completely safe to, and also keeping in mind that when it's not needed, we're not adding it as part of our treatment intervention, because I guess in the end, we don't want our patients to become kind of reliant on something that's quite passive. So, yeah.
So, as touched on slightly, dry needling versus acupuncture, there are a lot of similarities. I think the majority of the difference is how it's based. So, acupuncture is traditional Chinese medicine, and the idea is it's more about energy flow. So, you'll hear a lot more holistic practitioners completing acupuncture. Dry needling is obviously based on a bit more of anatomy and physiology, but in the way that it works for the patients, you'll often see there's a lot of crossover, and patients won't often be able to tell the difference a lot of the time. So the evidence, as we've said, it definitely, much like some of the other things that we've touched on, needs a fair bit more research at the moment, and there is some recommendations to have larger study groups. The NICE guidelines overall say that there is some evidence towards it, particularly when it's used as part of a multidisciplinary approach to healthcare. And in terms of the professional body's views, so Physio see it as the 4th pillar of practice as part of sort of kindred modalities, but again, touching on what Avni said, it's not to be overused just because it is such a passive entity, that we want patients to be empowered to manage themselves without relying on a service. And the Society of Physios in Acupuncture felt that NICE guidelines disregard the patient experience, which again touches on that placebo effect. Whilst we can't rely on that as the only source of information, it is quite important. And I think it's also worth mentioning a lot of the time sometimes we can use a tool to get somebody into the clinic, and during that time that we're treating them with, say, a passive modality, we can then address maybe some of the misconceptions they have. At the time they're lying down having acupuncture or dry needling, we can then talk to them about, what their goals are and empowering the patient a little bit more that way. So in conclusion, it is an effective tool, but most likely in conjunction with other therapies, and more research is needed, and as Avni said, it needs to be followed safely and with adequate training, and all part of that patient-centred approach, so not just by itself.
I guess I'll just add, and in terms of kind of personal experience, when I've used dry needling in my practice, it tends to be kind of the patients come in and they've had it in the past and they've kind of had good results from it. So usually it's one of those things I'll use with them. But if it's not something kind of someone has used in the past, it's almost one of those modalities I'll bring in if it's kind of, they've had that active approach already. They've been managing their pain through exercise, and then I'll bring it in just as an extra pain management strategy. That's about it.
Yeah, well done. Thank you.